In this video, we are going to show you how to calculate per visit wages. So what is per visit pay? Well, if you're watching this video and you're in home health and you're paying people per visit, you probably already know what this is. But I'm going to break it down for you. It's the equivalent of a piece rate. This is something that could easily be construed as what is a piece rate? Well, even if we're talking about an industry outside of home health, if I'm working in a manufacturing company where I'm developing a cylinder that has to be installed on houses, and I have to actually sit there and drill through it, I have to clean it up, I have to buff out the imperfections, I have to weld pieces to it. That's an example of a piece of item. So if my company pays me X number of dollars to finish that one piece, that's piece rate pay. So it's an item, piece, or task that somebody completes. So example, I'll pay you $25 every time you see a patient and complete the visit from start to finish. So piece rate employees must have their hours tracked for overtime. Piece rate employees are paid a flat rate to do work, but that doesn't necessarily mean it takes them exactly 1 hour to do it. I've met many healthcare professionals. I even met a person who is an LPN that worked home health that said she got paid $25 per visit, but she was at that person's house for 3 hours. So clearly, if you average that out, it's going to not be sometimes higher than minimum wage in that case. Sometimes she was at a patient's house for 5 hours and she only got $25. So regardless of the per visit rate, you must still track hours of work for purposes of overtime calculations. So here's an example. Jane is paid $25 per visit. She sees 30 patients for the work week and works 48 hours. So before we start jumping into the actual calculations themselves and how she's going to be paid, we need to break down exactly how you do this. So if you want, you can pause this video and of course write this down just so you know how to calculate it. So the visit compensation is the first thing you have to calculate. So you take the per visit rate times the number of visits. It's very simple. Now, the regular rate of pay is going to distinguish if you're paying at or above minimum wage or if you're paying less than minimum wage. So it's where you take your total compensation and you divide it by the total hours worked. The overtime premium rate is where you take the regular rate of pay that you just found and you multiply it by half because you've already paid for the straight time hours. The overtime premium is where you take the overtime premium rate and you multiply it by the overtime hours. And the gross pay is where you're taking the total compensation plus your overtime premium, and that's what you have to pay the employee. So jumping into the calculations, this is how we're going to calculate Jane's pay. $25 per visit times 30 visits. She gets $750. Her regular rate of pay, we're going to take her total compensation and we're going to divide it by 48 hours. So she gets an average rate of $15.625. So guess what? If we're in a state like California where the minimum wage is $15.50 an hour, she's above minimum wage, so she's good. If she were below it, you would have to give a minimum wage supplement to make sure that this person is paid at least minimum wage or above. The overtime premium rate, we're going to take that rate we just found, 15.625, and we're going to multiply times a half. And that's the half rate. In the overtime pay, we're going to take that overtime premium rate, we're going to multiply it by the number of hours over 40. And then, of course, the gross pay. We take their total visit compensation plus the overtime pay to get the total gross compensation owed to the employee. Now, in this next example, let's say Jane is paid $15 per visit and she sees 30 patients. She works 48 hours for the week. This is not too uncommon. This happens a lot. And as a matter of fact, I have seen this multiple times in reported items. So the minimum wage in this state is $10 an hour. So let's break this down. So her visit compensation is simple. $15 per visit times 30 visits is $450. Now remember, the regular rate of pay, we're taking that total visit compensation, we're dividing by the hours of work. And guess what? Her average rate of pay in this case is $9.37. So guess what? That's less than $10 an hour. She works in a state that requires a $10 an hour minimum wage. So because of this, you have to give her a wage supplement. So guess what? It's very easy to find this. If $10 an hour is the minimum wage, we have to take that $10 an hour and multiply it by 48 hours. It gives us $480. So she was only paid $450 and she needs to be paid $480. So therefore, you take that minus the amount she was actually paid and you give her an additional $30 minimum wage supplement. So from here, you need to figure out the overtime premium rate. Well, guess what? You're paying her just at minimum wage. So at this point, she's at $10 an hour times 0.5. So that's $5 an hour. The overtime pay, you take the overtime premium rate and multiply it by the 8 hours over 40 to get $40. The gross pay is where you're adding in the $450 visit compensation plus the $30 minimum wage supplement plus the $40 of overtime pay to get a total of $520. So remember, if employees' regular rate of pay is not equal to or greater than minimum wage, you must give them a minimum wage supplement.